All right, doctors, good afternoon. Great to see everybody. And as always, we hope you and your families are safe and well. Since it's 56 degrees outside, we're going to just move this whole thing outside. We're not going to do it on Zoom. We're tired of Zoom, and we're going to go outside. How's that?
Agree.
Sounds good.
I'm in.
We're in.
All right, the motion carries. We'll see everybody out. I don't know, we have to pick a place to go, but we'll figure it out. But anyway, enjoy it while it's here, because 12 hours from now, it's going to be back in the 30s again. But
Oh my God.
it's a welcome respite. So wonderful to see you. Welcome. Tonight's presentation is on the Doctors Council benefit plan. As I think each of you know, there are many things that Doctors Council as a union for doctors does. Of course, lifting up and advocating for doctors and patients in all aspects of what that means, making sure our members have a voice at work, making sure our contract is in existence and that we enforce it through the grievance and arbitration procedure, but also to make sure that the benefits are protected and that you and your family have access to good benefits. The benefits available through the Doctors Council benefit plan is part of our collective bargaining agreement by virtue of being a member of Doctors Council, meeting the eligibility requirements. And it's at no cost to you. It's employer paid through the collective bargaining agreement. Our presentation tonight will be done by Dan Donlin, who administers our benefit plan. I'm going to introduce Dan, then Dan's going to go through the 4-page summary booklet as we share a screen. Then Dan will go through the SPD, the summary plan document, anything that wasn't covered by the 4-page summary booklet. At the end of which, if you want to submit any questions in chat, if there are questions, we're more than glad to answer them and go from there. So without further ado, let me introduce Dan Donlin from our benefit plan. Dan?
Thanks, Kevin. Good evening, everyone. Good to see you. As Kevin said, the benefits that we have offered through the benefit plan at no cost. And we encourage everyone, eligible members and families, to take advantage of them. And of course, if there's any questions, our office is accessible by email, phone. We have our cell phones. You can contact me that as well. So I'd just like to go through the.
Okay, so we're going to share a screen now, or attempt to share a screen.
Yeah, there you go.
So,
Yeah.
okay.
So this is a booklet that many of you should be familiar with by now. We've had mailing it and emailed it to you. But just to go over from the top. So the first benefit, you see the healthcare cost reimbursement benefit. This is kind of like a summary of the most popular benefits that we have. Healthcare cost reimbursement is one that you can utilize by capturing any out-of-pocket expenses that you've incurred during the course of the plan year. Your plan year is January through December, January 1 to December 31. And it allows you to get reimbursed for out-of-pocket prescription drug co-payments, doctors co-pay visits, payments that you've had made for co-payments if you've had some medical procedures done, not covered by your primary insurance. And also the benefits that you get through the Doctors Council benefit plan that you weren't fully covered for, say, optical or dental, for example. And it's basically a form you would fill out, and you can get it on our website, or I can email it to you. And you would attach receipts for those expenses, explanation of benefits or EOBs that you receive from primary insurance or from the Doctors Council benefit plan. And you get reimbursed for a maximum of $1,000 per plan year per family. So one member could utilize that whole benefit and all expenses could be one, or it could be based on expenses incurred for your entire family. Just important note is if you are claiming expenses for yourself and other family members, you need to submit a separate claim form for each family member. The claim forms are submitted to administrative services only. They're in Lynbrook. The address is actually on the claim form, but you also can upload it through the administrative services website. After you've created an account, there's an option for you to upload the claim forms there to alleviate mail delays, snail mail. So you could do it that way. And if you need help establishing an account, you basically go on the website, asonet.com, create your account, you follow the prompts to do that. And then there'll be an option for you to upload claim forms. So you can do that there. The dental benefits are the other benefits that is a pretty rich dental plan. And there's no deductible, no premium that you pay. And if you go to a participating provider, then there is no cost to you for any covered service. So you can also go to the ASONET website to search for a participating provider. When you do that, you'll be asked to select your plan. Your plan is Doctors Council Benefit Plan B, and you would search for a participating provider by a location, by a specialty. When you contact the dentist, what I remind members to do is that not tell the dentist and provider that your Doctors Council Benefit Plan is your insurance, because most times they won't recognize Doctors Council benefits. So you would tell them when they ask you for insurance, it's administrative services only or self-insured dental service. On the website, there's an actual option that you can print an ID card. It's not an insurance card, but it's an ID card that will identify you as a participant in the plan. And you only need one card per family. Each family member doesn't need a card. But that will help you and the dentist recognize where your insurance or your benefit is from, and makes things a little bit easier. The maximum per family per year, again, it's a calendar year, $4,000 per individual, $8,000 per family member per year. Now, this also includes you have an orthodontic benefit that extends to not just children. It's a lifetime max of $4,940 it extends to adults. Adults can take advantage of it if needed. There's also an implant max of $5,000, lifetime max for your family. So that's a pretty widely used benefit. And if there's any questions about coverage, please contact me. I know there's some questions where dentists don't recognize the plan. Let me know by email or give me a call, and we can help straighten that out. The next benefit we have is a hearing aid benefit, which allows members and dependent children to get a hearing aid every 2 years, or be reimbursed for a hearing aid every 2 years for a maximum of $1,500 per ear every 2 years. We do coordinate with your primary insurance plan, but this is a good complement to any coverage that you may have through your primary insurance plan. In some cases, primary insurance does not cover hearing aids at all. But all required is a claim form for a hearing aid claim form. There's a section at the bottom of the form for the audiologist or ENT to complete and attach a statement from the audiologist or ENT with the charges, et cetera. And if you had submitted to a primary insurance carrier, a copy of the explanation of benefits as well, which shows what they covered, if anything. And then you would submit that claim to the fund office, and you can email those claims to the fund office. The email address is benefits@doctorscouncil.org on the claim form. You can fax it. or you can put it in the mail. We recommend faxing or emailing priority, of course, because that's the faster method. We just want to note, when you do fill out a claim form or any of these claim forms, just recognize that we operate 3 different plans here. One is welfare fund, you'll see, but it used the benefit plan claim forms, because if you use an incorrect form, it can get scanned into a different one of the different plans, and that will delay processing. So just keep that in mind. If you're unsure, please, again, just call, let me know. If you have any questions. Thanks. So any question about the hearing aid benefits, we do not need to speak with the audiologist. If they do have questions, they are welcome to contact us, but it's not necessary since it's just a reimbursement method. Next benefit is a legal services benefit. Now there's 2 different legal services benefit. There's one for residents who are residents in New York, and there's a residents who are out of state. So for the New York State resident, there's a 2 hours free consultation that you can discuss any particular matter with a lawyer from the law firm that represents the fund, which is Prior Cashman. The caveat here is you must have a certification form or a voucher from the plan office before you contact the law firm in order to speak with an attorney. And you simply, again, call or email the plan office, email me, and I would confirm your address. And if you're a New York State resident, I would email you the certification form. And on that form lists the name of the person to contact at the law firm. Her name is Peggy Beckwith, and she'll put you in touch with the attorney who will handle your particular matter. There are other services that they perform. It's at reduced rates. So just keep that in mind, that they do charge for the services, but it is at greatly reduced rates. And it's a pretty sizable law firm, and they handle a myriad of different services for our members. The other benefit is we'll call the out-of-state legal benefit, which allows members who live out of the state of New York to be reimbursed for an attorney of their own choosing to perform 2 specific legal functions or legal services, and one being preparation of a will or a codicil will, and the other being a real estate transaction such as a refi, purchase of a single-family or 2-family home, primary residence. And that is simply a form that it's called an out-of-state legal service form. And it can be gotten from our website or emailed to you. And you would have the statement from the attorney attached to that claim form. There's a section on that form for the attorney to complete as well. And you would be reimbursed for a maximum of $600 for either of those 2 services, real estate transaction or preparation of will or estate planning, for example. And you'd submit that to the plan office, and you would be reimbursed. Just have to show proof of payment with the exact statement, what the statement shows exact what services were done, and you'll get a check for $600 maximum. So that's the legal service benefit. Attorney adoption benefit, and this is fairly simple. The maternity adoption is a benefit that pays you for a birth or adoption of a child, and it's a maximum, it's $2,000 for a live birth or an adoption of a child. It's important to make sure the claim is submitted within a year from the date of service. In this case would be the date of birth or the effective date of the adoption. And it is a claim form, and all you would need to do is attach a copy of the birth certificate to the claim form or a copy of the adoption certificate to the claim form, and email it, mail it, same method to get that to the plan office. And then you would get a check for $2,000. It's you don't need to show hospital expenses or anything like that. It's just a copy of the birth certificate or adoption certificate, and you get a check for $2,000. The benefit for optical you have an option. You have to go either in network or out of network. So first, if you want to go to say a Lens Crafters or a Costco, and you get an eye exam, you get contact lenses, you get glasses, prescription glasses. This applies to only prescription, not something off the rack in CVS. And then you would submit an optical claim form, and then you would get reimbursed for a maximum of $300 per family member. So you can get glasses, get reimbursed with $300. A spouse can get contacts, paid up to $300, children, and so on. So it's each member of your family, $300 maximum reimbursement. Now, if you wanted to go to one of our participating providers, it's through our vendor CPS Optical. They also have a website, it's cpsoptical.com. And on their website, you can search for participating providers who will accept a voucher from the Doctors Council benefit plan, which will entitle you to an eye exam and a pair of glasses or a year's worth of single vision contact lenses at no cost. So you would contact the plan office first, request an optical voucher, and you would take that voucher, email it to you or mail it to you. You would take that voucher to the provider you choose, and then the provider would show you which rack or which case you can select frames from, and that are covered under the plan, and you would get your eye exam, or you'd select a year's worth of single vision contact lenses. You can't do both. It's either a pair of glasses or single vision contact lenses. So in essence, you could walk in and out without paying anything. You would just, as long as you stay within the allowable products. Now, if you wanted something, you see something at the provider's business place that you see a frame that you would prefer rather than what's covered under the plan, then in that case, you'd be credited for what's allowed under the plan, and you could purchase that other frame or the other type of contact lenses, say, and you would have to pay at that point. Now, it's important to recognize you can do either at a network, say like Lens Crafters, Costco, or you go to a participating provider. You can't do both in the same plan year. So again, January, December, if you go in January to a participating provider, then that is your choice for the year. Your family members can choose either one, but then it applies to both. That's your choice for the plan year until next year. The physical exam benefit, we have our provider, it's Executive Medical Services, also known as affiliated physicians, and they provide a comprehensive physical exam. They're located 255 Greenwich Street in Lower Manhattan. And there again, you would need a voucher or a certification form before you go to have your physical exam. You would, of course, request that from the plan office. We send it to you. You don't necessarily have to take it with you because it's also sent to executive medical, but it's a good idea to have it just in case. And then you would have, you schedule your appointment with them. You don't speak to the plan office about it. Whenever you schedule your appointment, you're entitled to it once a year. And it's based on the last anniversary of your last, this is benefits based on the last anniversary of your last exam. So if you went January 1 of 22, then you can go back in January 1 of 23. So it works that way. Any questions about that? Types of benefits, the services that are there when you get the voucher or the certification form, it has a list of the services that you're eligible for. Again, no cost. There are elective services there, or some services such as a stress test if it's recommended by your physician, and that will be done at no cost. The dietary benefit, it's for member spouses and domestic partners, which is important to note for the physical exam as well. I'm sorry, I bypassed that, but that's just for member spouse and domestic partners. So same with podiatry benefit. The podiatry benefit is a litany of services and fees that are covered under the benefit plan. The most popular, I would say, is just a visit to the podiatrist, an office visit. We reimburse for, I think it's $105 for initial visit and then $60 thereafter. But the orthotic appliances are probably the more popular ones. It's $225 per foot or $450 total for both feet. And here again, we do coordinate with your primary insurance carrier in case they do cover either of those. So most insurance carriers will cover some portion of the services that are rendered by a podiatrist, but not necessarily orthotics. So there again, we would need an explanation of benefits from your primary insurance carrier if you're having other services, having services, podiatry services. And if there's no reimbursement or no coverage by your primary insurance, we just need to see that. And we coordinate and you would get your maximum allowable amount under the plan. So to sum up, you have, if you were to take all the benefits that you would add to you could actually add it to your income in a way that you would not have to expend that are provided at no cost to you. It's a few $1,000s. And the last analysis we did, it was like $2,650. So it's something that you want to keep in mind and not lose sight of during the course of the year. I know it's difficult sometimes. Make sure you submit your claims on time. Most of the claims, it's a year from the date of service. If there's any question about that, please let me know. But this is just a partial list of the benefits that are available to our members and families. There's also additional benefits through SEIU on Union Plus. If you go to the website, unionplus.org, and there's an 800 number you can call. You can find out about the different benefits that they offer that are not necessarily, health benefits, but discounts on travel and car insurance, rentals, and so on. So that may be something for you to look into. We do have some questions about that on occasion. So that's something you may want to explore when you're looking at additional discounts. So
now we're going to transition to the summary plan document, the SPD. And when we emailed this out to the members, we had attached a 4-page summary and also a link to our website with the summary plan description of the SPD document. And Dan's going to go through now what's in the SPD that he didn't already cover. So Dan, can you speak a little bit about dependent coverage?
Sure. So dependent children up to age 19, we would need copies of birth certificates, make sure we have those on file. And any child over the age of 19 will be covered under the Affordable Care Act. It's what we call a special enrollment form that we can email you, and basically just you fill it out one time and the child will be covered up to the age of 26. And now under the benefit plan, it's till they reach the age of 26. It's not to the end of the calendar year when they were 26. So it's up to the age of 26. Thereafter that, they could pick up self-pay COBRA for a maximum of 36 months since they would lose that child status. So on occasion, if we know that your child is reaching that age of 19 or coming close to it, you contact the office and request a special enrollment form, and it'll be sent to you. And once you send it, you do it once, and then we update our system, and the child will be covered up to age 26. If the child is 19 or older, permanently disabled, either mentally or physically, that child would be covered continuously, provided there is proof of this disability, usually through Social Security Administration or other state recognized institution that shows that the child is disabled. And again, you only have to submit it one time, but it can the request to update it every year. It should be done once a year. And if any changes in your status, marital status, or dependent status, please let me know. Such as child is no longer eligible under the plan, and you want to continue self-pay COBRA, any change in what's going on with your dependent or spouse. We do coordinate the benefits with your primary insurance carrier, as I mentioned, with the other benefits. So depending on what coverage, what benefit you're selecting, say a podiatry or psychiatric, we do coordinate with your primary insurance carrier. So we must see the explanation of benefits, which shows what your plan covered, your insurance plan covered or didn't cover, so we can accurately reimburse you for the expenses that you're submitting. All right, claim filing. You have the option, like I said, to email, mail, or fax the claims. Make sure that the claims are submitted within a year from the date of service. The only one that's different is the healthcare cost reimbursement benefit. That allows you to submit the claim received by the 31st of December following the end of the previous plan year. So for example, we're in the January 22 to December 22 plan year. So if you have expenses under the healthcare cost reimbursement benefit, you have until December 31 of 2023 to get those to administrative services by that date. Not mailed it, they have to receive it by the 31st of the following year. So in this case, December 31 to 23, administrative services must receive that claim by that date for those expenses in that year. If you're mailing it, it must be postmarked by that date as well. So, and now you have the option to actually upload it, so you can do that as well. Disability claims is a little different, and this is something to keep in mind. If you are anticipating being out on disability, contact the office and request disability claims, initial application. One needs to be filled out by yourself and one by your attending physician. And they must be received, at least one of them anyway, must be received by the plan office within 3 weeks of the onset of the disability. That's 21 days. So if you don't submit it by that date, we don't get to, then each day that it's late is added to the extension period. There's a waiting period of 10 weeks. So that 10-week waiting period, there is no payment retroactive for that period, but the date that your first check would be sent to you or effective would be affected if you don't have it within 21 days of the disability. So make sure you get it by that time. Thereafter, you'll be asked to submit follow-ups on a monthly basis before any payments are made. And there again, make sure those are submitted timely. Any questions about it, or if you can't do it, you can have a family member or a friend send them if you're unable to do it. The blood benefit, this is where you're confined in a hospital and you need a blood transfusion. So you're eligible for up to 10 units and per confinement or a period that you're in the hospital. And you would need, there's a claim form you can get from the office. It has to be directed or authorized by the doctor that you need the blood. And you would send both a receipt that's showing you had those units of blood, and then you would be sent, I think it's, sorry, what the amount is. Oh, actually, there is no amount. But it's a maximum of 10 units. So whatever the cost is, and whatever insurance you have, the out-of-pocket piece, the EOB, or explanation of benefits from your primary insurance. So we would pick up the difference.
All right, Dan, the next thing on the SPD, the summary plan document, is the dental benefit. You've covered the dental benefits. Is that correct? Is there anything you want to flesh out further?
No, just make sure that the dental claims are submitted to Administrative Services. If you send them here, I'm only going to forward it to them by mail. So
Right.
please send it to their address, Merrick Road.
Okay. We'll go ahead now to the disability benefit.
So disability, just briefly touched on the period. You can get monthly disability payments for a maximum of 36 months. You must be totally disabled. It means you can't perform the duties of your profession. So the attending physician will detail, there's a form of the initial disability that's detailed, and must provide a detailed explanation of the disability, and it's reviewed for accuracy and eligibility here. And if you are eligible, the disability benefit is $1,500 per month for a maximum of 36 months. The first 6 months, there's Social Security is deducted and Medicare tax is deducted for the first 6 months, and then thereafter it's $1,500.
Okay. That brings us to healthcare cost reimbursement, which you touched upon. Is there anything further you'd like to flesh out?
No, I think that's pretty much self-explanatory. Just make sure it goes to Administrative Services and not here.
Okay, hearing aid.
Hearing aid, we did touch on, extends to children. We do coordinate with the primary insurance. Legal services, we did touch on.
And again, I think in legal services, you'll see the different greatly reduced rates for, right, correct, Dan?
Right, those, I mean, the primary closure or primary residence is very reasonable, $575. So if you review the SPD, when you can, there's a myriad of different services, and the fees that are charged are in that SPD.
And you get, correct me if I'm wrong, Dan, but you get 2 hours of free consultation and 50 additional hours at the reduced rate of $200 for general consultation.
Right, I mean, that's this is for in-state, in New York State residents.
Out of state, is a reimbursement up to $600?
$600 based on the two services, which were real estate transactions or will preparation and estate planning.
Yeah.
Mammography benefit, again, here's one we would coordinate with your primary insurance carrier. You would send a claim form, mammography claim form with an EOB from your primary carrier, and we would pay a maximum of $200 for that service a year. Paternity adoption benefit, I touched on it earlier. It's pretty simple. You have not even reimbursement. You'd be paid $2,000 per claim, one claim per year for birth or adoption of a child. Optical benefit, we touched on that. You'll have, if there is another plan that you have, I don't think you guys do, we do coordinate with that benefit as well. But for the most part, it's pretty straightforward. You send a receipt or you go to a PPO, CPS Optical. The physical exam, that is done by affiliated physicians or executive medical services. They're just 255 Greenwich Street. And this is a list of the different examination of services that they function at that facility. And if you need additional services such as a stress test, it's not listed here, but it is on the form where it's recommended by your physician. They will do that as well. Podiatry is available to spouses, members, domestic partners, And the maximum allowance per plan year is $5,000, including all the different services that would be performed. But most popular, as I mentioned, is of orthotics, and that's pretty simple at $450 maximum per for both feet. And as you can see, these are the different fees that we reimburse for in coordination with your primary carrier. Private duty nursing, this is if you're confined to a hospital, acute care facility, and the doctor orders a nurse. It must be an RN or an LPN, and you're allowed $900 per 24-hour period for a maximum of $5,000, $5,400 once you're confined. But that's a pretty good benefit. Psychiatric, this is for at a hospital. Here's where we do coordinate with your primary insurance carrier. In some cases, the carrier is provider is not is out of network, or not your insurance carrier does not provide reimbursement for out of network. So here's very important that we receive the explanation of benefits, regardless of whether your carrier pays for the provider or not, reimburses you at all. So it's important to send that with the psychiatric claim form. There's a section on that form for the provider to complete on the bottom of that form. So COBRA, when a member changes status, loses coverage, either your title changes, say, or you're leaving or terminated, it's important to contact the fund office, plan office, and let us know of that event. Same as if your child is losing status as a child, that means you don't have the, they've exhausted the under the special enrollment at their age 26. So to contact the plan office, and if you wish to continue the COBRA benefits, if you're leaving service or terminated from service, retiring, et cetera, the maximum COBRA coverage is for 18 months. It's paid monthly, and depending on if it's a family coverage or individual or child, the rates are different. They change every year. They go up or down a few dollars either way, not usually more than that. And your payments can be done monthly, and if you don't wish to continue, you could just stop paying and say, I no longer wish to coverage, or you just let me know that you don't wish to continue COBRA. For a dependent child losing coverage, its maximum is 36 months.
So Dan, the rest of the document is primarily
Information.
plan information. Is there anything else you'd like to point out in the assembly plan description, the SPD document?
No, I think that's pretty much it. I know sometimes it can be a little overwhelming or confusing about when claims can be submitted, when it should be submitted, and so on. But please don't hesitate to contact me or the plan office to answer any questions, and I'll try to get back to you as soon as I can.
And Dan, could you touch a little bit about if someone wants to get the appropriate form, in addition to calling or emailing for them, can they go to the website and get, and how can they go to the website and get the form?
The website is doctorscouncil.org. There's a tab to the right when you get to the homepage, say member services, and then there's a drop-down menu. The second item on that menu will say benefits and welfare funds. Once you select that, that'll bring you to the page where you'll see 6 different plans. Your plan is number 4. We'll say Doctors Council Benefit Plan B. And in blue letters, you'll see the different claim forms that you can print. They're combination forms. So if you're looking for optical, it's also part of 3 other benefits on that form. And the SPD is also listed in blue letters. You can click that, and you can print the claim forms from there, from our website. And it's probably the easiest way to do it. But of course, if you need assistance, just let me know.
Thank you, Dan, for carrying us through that presentation. We have some questions in the chat. We're going to try to go through the questions in the Zoom chat. If folks have further questions, please just simply type them in the chat and we'll endeavor to get to them. Dan,
Thanks.
the first question, Dan, is there a change in reimbursement for health insurance premium?
Yes, actually, it was. Unfortunately, that was no longer, should not have been from the beginning. We had allowed members to get reimbursed for the health insurance premium, but on the regulations, it was not permitted, IRS regulations. So we had to discontinue that. But you can get reimbursed for it's through your employer. If you can get reimbursed if you're paying or your spouse is paying for another health insurance, it's not part of your employment. That's different.
Gotcha. Can you please clarify, is my 19-year-old dependent eligible for these benefits?
Yes, up to age 19, and then thereafter, just complete a special enrollment form that allow your child to continue up to age 26.
And then there's a similar question. Please clarify, if my child turns 26 in February, is she covered until the end of February?
Till the end of February, yes.
There's a question, how can I get a copy of the full 52-page booklet of benefits? You should already have it. When we emailed out the tonight's meeting, it said, please click here for a link of the SPD, the summary plan document. So folks, you should already have that. Just go to the link that says, please click here for the summary plan document. So that which we just carried you through is in the link of the email that we sent out. Let's see here. Are there any oral surgeon or gum specialists on the plan?
Yes.
There are.
Yep.
Okay.
You search on the ASO website.
Do the mental health service benefits apply to dependents?
Yes.
I know you said this should be covered by my employer. However, I pay union dues each check. Is this typical? Yes, the payment of the dues to the union allows the union to function in all aspects in terms of member engagement, communication, outreach, having a voice at work, bargaining a contract enforcement, and many other things. Part of the collective bargaining agreement or contract, which we negotiate, is this benefit that's paid for by the employer. So that's how that operates. The person says, I don't see the link. Anybody who RSVP tonight, or you're on it, we're going to be sending out the video of the presentation. And once again, we'll send a link to the SPD documents. There was a 4-page description attached as a PDF. And then in the text of the email, it said, please click here for the link to the SPD. And anybody who's on the call tonight, we're going to send out a video of this presentation, the 4-page booklet, and a link to the full SPD, so you'll get it again. Are the COBRA benefits that we entitled to and will be paying for reimbursable by Doctors Council?
No.
Thank you. Well, thank you, Doctor. Any other questions?
Yes. Can you hear me, Kevin?
Yes, Dr. Hassan.
Yeah. There's one benefit that we don't have at this time, and I'm personally aware of 2 doctors who are in, we are getting old, and there's one-time benefit that I think should be entertained, and that is for cataract surgery. Somehow, some parts of cataract surgery are not covered by any insurance. Like if you want a laser surgery or if you want a specialized lens. So, that part is not covered. Maybe it is one-time benefit, but maybe it should be offered.
So Dr. Hassan, thank you. You're referring to cataract surgery, correct?
Correct.
All right, so we'll have Dan look into it, talk to the folks who can able to assess this, but thank you for that suggestion. Dan, we'll look into the cataract surgery.
Okay.
Thank you.
Thank you.
Thank you, Dr. Hassan. Well, doctors, if there's no further questions, again, everybody, the SPD also, the summary plan document is on the website. If you go to doctorscouncil.org, go to benefits, you'll click it, it's there on the website. It's on the emails we sent out. We'll send it out again. If for any reason you don't see an email, just call us at 212-532-7690. We'll gladly share that with you. Thank you, everybody, for taking the time to join on this call. We encourage you to know what your benefits are. We encourage you to use them. That's why they're there for you and your family. Good seeing everybody again. We hope you found this presentation useful and informative. It's not an end-all be-all. If you have a question afterwards, just shoot us an email, pick up the phone. We'll gladly get back to you. So thank you. Thanks, Dan
Thank you.
Donlin.
Thank
Thanks,
you.
Dan Donlin, for doing the presentation. Doctors, we appreciate you jumping on the call. Please enjoy the rest of your night. And as always, stay safe and stay well. Best to you and your families. Thank you.
Thanks, Kevin. Thanks, Dan. Thank you.
Thank you.
You're
Have a good night.
Thank
Good
you, you
night.
too.
Thank you.
Bye-bye.
Bye.